suffering from is called obsessive compulsive behavior.
Throw the ball, throw the ball, throw the ball.
Ever you want the ball, I want you to think about something else.
Just don't say anything more. Just throw the ball.
Can you relax your mind?
This is the way it works. The other person, he threw the ball! Oh, he threw the ball! He threw the ball!
If only we could have a conversation like that with our pets and really learn what they're thinking and have them understand us. But we can't.
That's what they'd be saying a lot. Feed me, throw the ball.
Just stop talking to me and give me what I want.
Yes, exactly. We are not Dr. Doolittle, unfortunately, so that means that the best we can do is ask the experts. And today we're getting some of your pet questions answered. Dr. Eric Ruhland joins us from the St. Paul Pet Hospital. Good morning. Oh, and you have a friend with you this morning. Good morning, Dr. Eric.
Good morning, guys.
Okay,
Good morning. Yeah, this is Ren. Ren is Butter's fill-in.
Yeah. Okay, Dr. Eric, we have
Ren is Butter's fill-in for our Mondays.
We have so many questions. We're not going to be able to get to all of them, but we want to try to rapid fire as many viewers have questions. Andrea says, my 1.5-year-old Doodle is aggressive towards me when she gets a hold of things that she shouldn't. She is not aggressive when it's a toy. How does she know the difference, and any tips or tricks to stop this?
So what's probably happening, Andrea, with this is a really good case of resource guarding. And the reason your dog knows that you're taking a toy and playing it is probably because right when you take it from them, you throw it. And the dog knows that part of the game is that you're gonna throw it again and release it, versus that when you're taking something from them. Something in that situation, how you can prevent that is keep whatever you have in your hand, like whatever they're resource guarding, give it to them and never try to take it from them, and never engage with that dog when they're in that situation. And try not to let this turn into a situation where the dog definitely has something they're guarding and they're not. The items that they are resource guarding, you have two situations. You either give that to the dog entirely and you never touch it physically as a human, or you remove those items from the house and you just stick with your play items. Does the dog know between a play item and not? No, they don't really classify that in their brain, but they think that the toy is something that you're going to always play with.
Okay.
Sure. Yeah, they think it's a game. Okay, Brad says, my 6-year-old rescue pup never interacts with other dogs. He says, we keep to ourselves. Does he still need shots from the vet? He is very healthy and active, and again, they say they don't interact with other dogs. Do they need their shots?
That is a great question. And to be honest, you guys, the majority of infectious diseases that I treat in the hospital that are preventable are things like leptospirosis and Lyme disease. Those are not diseases that come from other dogs, right? We think about distemper and rabies. Those are the big ones that other dogs can contract. But what we're trying to prevent when a dog comes into my clinic and we're vaccinating a dog, you're not preventing a situation that you can control. Almost always, you're trying to prevent a situation that you can't control. Like lepto is transmitted by rats and raccoons and everything. There might be a situation where I'm walking my dog or let my dog off leash for a little bit and finds a rat in a wood pile. These types of situations happen all the time. We're trying to avoid a situation that you can't control. And so for something like that, no, these dogs, like all dogs, deserve the same level of protection. And sorry, but your dog's not exempt from that.
Okay, good stuff. Anita writes, I'm ready to scream. Maybe I already did, she says. My cat bites excessively. What is the best remedy for this 3-year-old boy who bites?
Boy, once a cat and a dog, once they learn that their mouth is a tool and gets a reaction, it's very, very challenging. One thing you can do, especially if this is associated with sometimes with food, is getting an automatic feeder that will feed the cat, and you're trying to disassociate that cat's either dependency on them, and sometimes this is food motivated. So if an automatic feeder is a fantastic idea. Aggressive play and sometimes stimulation with some of these cats they don't particularly like. So some cats are just a little more hands-off. And you know, this may be a situation, and I see this a lot, where cats need to be, some cats need to be rehomed, and obviously seeking a behavioral specialist, a veterinary behavioral specialist in this situation, and there are a few of them in the cities, I would highly recommend that we do that first. That's no substitute for some of my recommendations, but I would say that, that a behavioralist is going to help best in this situation.
Yeah, and okay to ask for help sometimes with those problems. All right, next up, Cheryl asks, my dachshund won't let me clip her nails. I've tried prescription meds and CBD, but she still fights me on the nail clipping. What can I do?
That's a really challenging one, because if a dog has been clipped once or twice too short, it's just like you taking your finger, and if I take a nail and if I took a scissors and cut the end of your finger off, I probably would never let you touch my hand again, like ever. So that's normal and it's natural. What I have for some patients is they come in twice a year to do a medical sedated procedure. It lasts, you know, it's probably under $130 to $150. They come in, they get sedated, they take a nap for a half an hour. We do all the other things that we need to do. And then from the medical side, that's probably the easiest way. One thing you can do is try distracting the dog. So that's most aggressive, and I wouldn't say aggressive, but kind of the easiest way from the clinician side and for us to do it. What you can do sometimes is distracting the dog and trying to just get one nail done at a time. That works sometimes with some patients. A highly motivated treat or some type of special food, and distracting the dog and somebody distracting their head, and just do one nail at a time. Make sure your clippers are super sharp, and make sure that that you do not quick them. Make sure that's not too short. You're just going to take a millimeter at a time. We're just trying to get that dog used to you touching the nail. And the other thing you could do too at home is try to hold the dog's paw for an extended period of time, and just let them get used to that, and associate that with a treat.
It looks like she's ready for you to cut her nails. She's like putting her paw up and ready to go.
You can do any, like Ren and Butter are kind of, you know, Ren is sort of the thinner, taller version of Butter, but you can do anything with, and she's about the most chill dog you've ever met.
She's like balancing on there. Piper would be jumping off and going crazy. Dr. Eric,
What a good girl.
can she kiss on demand? Can you give a kiss or a shake or something?
Can you shake? You want to shake? Shake. Come on, you can do it. Good dog.
Good job, Dr.
There she goes.
Dr. Eric, thanks so much. I kind of set you up for that. I'm sorry. All right. As I mentioned, we did not get to all of the questions. I know we have so many on our Facebook page. We will do another Ask the Vet segment in the future very quickly with Dr. Eric. So thank you for bringing them in. There's just not enough time.
Yeah, we will get to them. We will ask Dr. Eric. He always has great advice.